Suffering from pink eye? AzaSite Azithromycin could be the solution. In this video, we'll break down how it works, the correct dosage, and what side effects to watch for, so you can treat your eye infection safely and effectively. What is AzaSite Azithromycin? AzaSite Azithromycin is a prescription ophthalmic solution specifically formulated to treat bacterial conjunctivitis, commonly referred to as pink eye. As a member of the macrolide antibiotic class, it is FDA approved for use in adults and children aged 1 year and older. This medication works by delivering targeted antibiotic action directly to the eye, helping eliminate the bacteria responsible for the infection. The standard recommended dosage is 1 drop in the affected eye once or twice daily for 7 days, depending on your provider's instructions. When used as prescribed, AzaSite Azithromycin is generally well tolerated, with most individuals reporting minimal to no side effects. What is AzaSite Azithromycin used for? Treatment of bacterial conjunctivitis. Pink eye. How does AzaSite Azithromycin work? AzaSite Azithromycin is a macrolide antibiotic that inhibits bacterial growth by blocking production of essential proteins needed for bacterial survival. By stopping protein synthesis, it helps the immune system eliminate the infection more effectively. AzaSite Azithromycin, dosage forms and cost. AzaSite Azithromycin is available as a 1% ophthalmic solution and comes in a 2.5 milliliters eyedropper bottle. This formulation is designed for direct application to the eye to treat bacterial conjunctivitis effectively. As of the latest pricing data, the average cost for one 2.5 milliliters bottle of AzaSite 1% is approximately $205.02 when using a free GoodRx coupon, a savings of 33.03% off the standard retail price of $306.14. Prices may vary depending on pharmacy location and insurance coverage. Typical dosage for AzaSite Azithromycin. The full course of treatment with AzaSite Azithromycin lasts for 7 days. Here's the standard dosing schedule. Days 1 and 2. Instill 1 drop into affected eyes twice daily, approximately 8 to 12 hours apart. Days 3 through 7. Instill 1 drop into affected eyes once daily. It is important to complete the entire treatment course, even if symptoms improve earlier, to ensure full eradication of the infection. Side effect of AzaSite Azithromycin. While many patients tolerate AzaSite well, some side effects may occur. Most are mild and tend to resolve as your body adjusts to the medication. However, you should consult your healthcare provider if symptoms persist or worsen. Common side effect. Mild eye irritation, reported in approximately 1 to 2% of patients. Other reported side effects include blurry vision, temporary eye burning or stinging, dryness of the eye pain or discomfort, eye itching, eye discharge, inflammation of the cornea, keratitis, nasal congestion. Serious side effects. Seek immediate medical attention if you experience signs of severe allergic reaction, such as swelling of the eyelids, eye redness and intense itching, skin rash or hives, shortness of breath. Prompt treatment is critical if allergic symptoms occur. Pharmacist tips for using AzaSite Azithromycin. For the best results and to ensure your safety, it's important to use AzaSite Azithromycin exactly as directed by your healthcare provider. Do not stop treatment early, even if your eye begins to feel better. Ending treatment prematurely increases the risk of your infection returning or becoming resistant to antibiotics. When applying the eye drops, take care not to let the tip of the bottle touch any surface, including your eye, eyelid, fingers, or any other object. Contaminating the dropper tip can introduce harmful bacteria and lead to serious eye infections. If you wear contact lenses, it's generally recommended to avoid using them while treating an active eye infection. Contact lenses can worsen irritation or interfere with healing. Your prescriber will advise you when it's safe to resume wearing them. To help prevent spreading or worsening the infection, wash your hands thoroughly with soap and water before and after applying AzaSite. Practicing good hand hygiene is essential in managing and preventing eye infections. Storage instructions. Store AzaSite in the refrigerator after picking it up from the pharmacy. Once opened, the bottle may be stored at refrigerator or room temperature, but it should be discarded 14 days after opening. Do not use expired or leftover eye drops, as they can be ineffective or even harmful. How to properly apply AzaSite, Azithromycin. Shake the bottle once before each use. Pull down your lower eyelid with one hand to form a small pocket. Hold the bottle upside down, just above your eye, and gently squeeze out the required number of drops. Close your eye, then gently press a finger to the inner corner of your eye near your nose for about 1 minute. This helps keep the medication in your eye and reduces the chance of it draining into your nose or throat. Want to learn more about safe and effective medication use? Subscribe to HeInfo for trusted health information from real professionals. Like this video, share it with someone who needs it, and comment below if you have questions or experiences to share. Your eye health matters. Take care of it with knowledge and confidence.